Our PRAISE project, entitled The Influence of Extracorporeal Membrane Oxygenation for Severe COVID-19, evaluates the use of laboratory testing to support the treatment of severe COVID-19 related acute respiratory distress syndrome, which is also referred to as ARDS, by using ECMO therapy. The effectiveness of ECMO support in such cases will also be described through comparisons of morbidity and mortality rates. Extracorporeal membrane oxygenation, otherwise known as ECMO, has been used as a treatment method in severe cases of COVID-19 since the beginning of the pandemic in March 2020. Patients that are considered for this therapy are often experiencing severe respiratory distress and inflammation as a result of the viral infection. While some people are more predisposed to developing a severe infection, most COVID-19 infections begin with the same symptoms, which consist of a dry cough, fever, persistent headache, and shortness of breath. There are certain risk factors that play a role in the severity of the infection in some individuals, most of which are associated with lifestyle and medical history. The major risk factors include history of cardiovascular disease, chronic respiratory diseases like COPD and cystic fibrosis, along with obesity. Immunocompromised individuals are also more susceptible to severe infection since their immune systems are not equipped to fight off the virus as efficiently. These severe COVID-19 infections often cause respiratory distress in these patients, leading to ARDS, which leads to a decreased amount of oxygen in circulation since the lungs are not properly functioning. This can lead to respiratory damage as well as multiple organ system involvement in prolonged severe cases. If traditional therapies and mechanical ventilation methods do not improve the patient's condition, ECMO therapy will be considered. This form of therapy acts as a stand-in functioning pulmonary system, providing the lungs a chance to heal from the inflammation. This case study project surrounds that of a middle-aged man who presented to the emergency room with severe COVID-19 symptoms and difficulty breathing. After admission, his condition worsened consistently and was placed on veno-venous ECMO therapy to progress his recovery. Laboratory values are consistently monitored to evaluate the course of treatment and its effectiveness. In severe COVID-19 related ARDS, including these patients on ECMO therapy, lab values collected will include arterial blood gases, or ABGs, liver panels, basic metabolic panels, and inflammatory markers like C-reactive protein. A complete blood count with differential along with coagulation tests are also monitored consistently. Significant laboratory values in these cases are as follows. The ABG tends to yield a decreased partial pressure of oxygen, or PO2, and a decreased blood pH with an increase in the partial pressure of carbon dioxide, otherwise known as PCO2. All of these results indicate a respiratory acidosis condition. The liver panels often showcase increased AST and ALT, which are both liver enzymes that are elevated in cases of severe infection and can also indicate multiple organ involvement. CBC with differential will also show increased white blood cells, which is a common finding in severe viral infections. The coagulation tests collected will show an elevated D-dimer, fibrinogen, and APTT, which are all used to measure the coagulation processes of the patient on ECMO therapy. These particular values are used to prevent bleeding episodes that may occur due to the configuration of ECMO therapy, which will be discussed shortly. Laboratory testing revolves heavily around testing methodologies and analyzers that are able to accurately obtain and calculate patient results to monitor therapy and provide high patient outcomes. The ABGs in this case study were measured on Siemens Rapid Point 500, which uses both Clark and Severing-House electrodes to determine the oxygen, carbon dioxide, and pH levels of the patient sample. The chemistry analyzers were used to calculate the liver panels, basic metabolic panels, etc., were the Beckman culture DXI 800 and the DXC 700AU, which both utilize a mix of ion-selective electrodes as well as enzymatic and colorimetric detection, depending on what value is being measured. Finally, one of the hallmark analyzers throughout the COVID-19 pandemic was the Cepheid machine, which uses PCR to determine if the patient is infected with the COVID-19 virus. By monitoring these laboratory values in cases of severe COVID-19 related ARDS, Treatment methods can be assessed, and alternative strategies can be implemented if necessary to allow for the best and most efficient recovery. If severe COVID-19 infections are left untreated for prolonged periods of time, various organ systems in the body will become involved due to the lack of oxygen circulation, as well as an overall immune response to fight the infection. The main target of this infection is the pulmonary system, and in severe cases, CT scans can show a phenomenon known as ground glass opacification, which ultimately prevents the lungs from expanding properly and obtaining sufficient oxygen. A decrease in oxygen can lead to cardiovascular problems, since the blood is not receiving enough oxygen to properly distribute to the organs, which will severely affect the heart. Inflammation can also damage various other organ systems and may be the result of cytokine storms, which can occur when the immune system becomes overstimulated and overworked, which is a trait in severe infections like the COVID-19 related ARDS. ECMO therapy is often used in these cases to give the body a chance to recover from the inflammation. Prior to the COVID-19 pandemic, ECMO therapy was used in cases of respiratory distress and cardiac surgeries, often following whole organ transplants. There are two main types, vivo-venous and vivo-arterial. Vivo-venous is frequently used in respiratory cases, so that is the main focus of the study. The overall configuration consists of two canalulae, one in the femoral vein and the other in the jugular. Blood is shunted out of the exporting vein, which is sent through the oxygenator where adequate oxygen is added, and then sent back through the importing vessel and back into circulation. This process is shown in Figure 1, and this process is meant to serve as a stand-in pulmonary system to allow the lungs to recover while providing other organ systems with proper oxygenation. There are certain requirements that an individual must meet in order to be considered for ECMO therapy. If a patient has a PO2 of less than 150, as well as a PO2 of less than 80 for 6+ hours, or a PO2 of less than 50 for 3+ hours, and or a pH of less than 7.2 with a PCO2 of greater than 60 for 6+ hours, they may be considered. Also, if a patient has a partial pressure of oxygen over 150, or a PO2 of 150, accompanied with a pH of less than 7.25 and a PCO2 of greater than 60, they may also be considered. This is shown in the flowchart, which is depicted in Figure 2, and these findings are based on, and this diagram is based on the findings that was found by Janelle Badalock and her colleagues. In the beginning of the pandemic, the mortality rates associated with the usage of ECMO therapy and severe COVID-19 infections was 94.1%, which effectively raised questions on whether or not this therapy was truly effective in treating severe cases of COVID-19. But this high value was likely due to the lack of understanding of the virus and its course of infection. As of March 2022, the mortality rate is down to 50%, which is likely due to the increased understanding of how to treat this infection and the overall course of the infection and how it affects different individuals. It was also found that earlier implementation of intense therapies like ECMO yielded higher success rates, as it gives the body more time to recover. If ECMO therapy does not prove to be effective, or if the patient's lungs are far too damaged to ever become fully functional again, after all therapies have been utilized and attempted, an alternative option is a double lung transplant, which has a near 100% success rate in these individuals. There are certain limitations to this particular study that are all mainly due to the fact that the studies utilized and followed for this information all consisted of small sample sizes, and the fact that it's been proven that there are a lot of different responses to the COVID-19 infection in different individuals based on a ton of different factors, including their risk factors, ethnicity, age, etc. So the overall course and severity of the infection, as well as the effectiveness of ECMO therapy, can vary among these individuals. In conclusion, the use of ECMO therapy in these cases of severe COVID-19 related ARDS has become more successful over the course of the pandemic. Overall, this therapy provides the body a chance to recover from the traumatic inflammation that can result from these severe infections by assisting in proper blood oxygenation and circulation. By monitoring the course of infection and treatment via the laboratory values discussed, earlier implementation of these therapies has become standard protocol, which improved patient outcomes overall. Thank you.